Today, I'm gonna get my ass kicked by Scott in the pro wrestling ring. But first, let's pay a visit to our plastic surgeon. So we're here with Dr. Honrado, who is a facial plastic surgeon and does lots of other non-invasive therapies. And today we're gonna be doing an Ulthera treatment, which is a new, really hot treatment because there's no downtime, very little pain at all, and it's a really dramatic difference immediately. Can you tell us a little bit about Ulthera first of all?
Sure, absolutely. Ulthera is a new device, as you've mentioned, and what it uses ultrasound to create heat, and that heat basically creates a traumatic response, and it creates a healing response. And as you continue to heal, and collagen is laid down, that's when you get kind of a lifting and tightening and more rejuvenated look. So
it's kind of like a facelift without...
Exactly.
Okay.
Exactly. Without any incisions, without any anesthesia at all.
Okay, and compared to a facelift, how effective is it?
Yeah, it certainly doesn't replace a facelift at all, but it's nice for patients who have just a little bit of laxity of skin, a little bit of wrinkling. It actually really helps tighten those areas up.
And where can it be used? What part of the body or the face?
Mostly, like, we're using it for the facial area, like neck, cheek, and then the brow, but people actually also use it for the arms, legs, and buttocks region.
And how long does the effect last?
Usually we're seeing like about a year and a half for most people, although each person really, it just varies per person.
And can they do multiple treatments?
There's no problem with doing 1, 2, 3 treatments at all. I mean, some people...
Is it recommended?
It's usually recommended like every year.
Okay.
But you can certainly do more if you like the effects more frequently.
So people get addicted to Botox or whatever can come in and get their Ulthera every couple months.
Exactly.
And what are the negative effects? I mean, are there like things you have to watch out for?
Actually, the nice thing about Ulthera is that there's really almost no negative effects. I mean, people can get a little bruising and swelling afterwards, but that's really only temporary. Some people do feel that they might have like numbness afterwards, but that also is very temporary.
And how about, you know, when people get fillers and people get facelifts or implants, sometimes they end up looking not necessarily younger, but different. How does this treatment, if you keep doing it, are you going to look different? Or are you going to look like a different person?
No, absolutely. And then that's one of the reasons why I myself do the procedure, because I mean, I found that there's certain ways to do it where you can keep things naturally, but also, you know, with an effect. So unlike fillers and Botox where you can look a little bit different, I haven't seen that with this treatment at all.
So you don't get kind of the swollen face, Real Housewives of New Jersey.
Exactly, surprised look, you know, big lips at all, no.
Right, and this is something that obviously leaves expression in your face.
Absolutely, without preventing any sort of relaxation at all.
Is that kind of the new trend that you're seeing, is that the expression's coming back? Yeah. That frozen face, swollen look is going out?
Yeah, I think what people want to have done is that they want to look younger, but not necessarily different. You know, they just want to look rejuvenated,
fresh,
you know, but still have animation.